You are in tune with the nation's stations, ABS TV Channel 10, the GIS, and ABS Radio 90.5 FM. Proudly serving you, reaching more and more people every day. Hello, good evening, and a warm welcome to another edition of House Calls. It is the best and most powerful health program anywhere in the Caribbean. And we say that without being hyperbolic, without being boastful. But it is a program to ensure that you are kept across all the latest information in relation to your health. It's one of those programs that could actually make the difference between life and death. Again, we're not being hyperbolic about it. So this evening, we're talking about the issue of mental health. And we zoom in on anxiety disorders. That's right. We're also focusing on the issue of mental health because health is really a 360 kind of consideration to make sure that you're fully okay, you're well. Wellness also takes into account mental health. So this evening, how do you know if you have anxiety disorders? What are the signs and symptoms? What are the risk factors? How can you ensure that you lower your risk factors? How do you know that people around you have anxiety disorders? I mean, do you have, for example, a sort of flare-up? How do you know the difference between like a flare-up when you get a little bit anxious about something or a little bit concerned about something and you kind of get a little hot off the cuff? How do you know the difference between that, which is a one-off, and an anxiety disorder? So this evening, we're going to be unpacking and deconstructing all of that. We have with us Dr. Chanel Joseph. Dr. Chanel Joseph is a consultant in internal medicine and also a consultant in psychiatry. So she'll be talking with us right through about this issue of anxiety disorders. Welcome to House Calls. The program is sponsored by Sagicor, the kind compliments of Pink Mongoose and H.E. Morgan. Very good evening to you, Dr. Joseph. Really appreciate you being with us this evening. We are immensely in your debt because we know that you're extremely busy. Thank you.
Thank you for having me.
Excellent. So we normally start off by introducing our audience to the doctor in the house. So just a little bit about yourself, just for our audience to meet Dr. Chanel Joseph.
Okay. Well, I'm Antiguan born. I grew up in Bendals. I did undergrad in Canada, Dalhousie University. I attended AUA for medical school. I did my combined training of internal medicine and psychiatry in Springfield, Illinois. That took 5 years. And then I worked in North Dakota for about 4 years before returning home October of last year.
Excellent. That was brilliant. You put all of that information in a very short capsule. Excellent. Well done. All right. So this issue of anxiety disorders, Dr. Joseph, generally, what's the definition? What are anxiety disorders? And how do you know when you have anxiety disorder?
Well, in order to understand anxiety disorders, you first have to appreciate what is anxiety. And some people might be surprised to learn that anxiety is actually a normal thing. It is a normal response that we all have towards stress. And I'll give a few examples. Let's say you're in college and you got an assignment that's due in 3 months. You're not going to go home and start it tonight, maybe even a month from now. But 1 month before, 2 weeks before, a week before, 3 days before, there's a feeling that starts to get generated inside of you. Something in the pit of your stomach you can't really describe. Your sleep patterns might change a little bit. You're up a little bit later. Your appetite changes. Your attention, your focus is heightened. You're now motivated to get this done, whereas you weren't 3 months ago. All those things are components of anxiety. Anxiety helps us to accomplish tasks, to stay on goal, helps us with our day-to-day activities. Anxiety is also a part of our alert system, our danger system. For example, for individuals who have diabetes, anxiety or an anxious feeling is usually a sign that your blood sugar is either too high or too low. So it helps to warn us that something is going on that we need to be focused on. Once the event that's triggering the anxiety is resolved, you're no longer in danger, the assignment's turned in, you got an A, the anxiety tends to go away. So anxiety is beneficial and it's transient. It serves its purpose and it goes away. With anxiety disorders, it's our normal mechanism, but it gets hijacked for whatever reason. So it's like somebody turning on your alert system and it just stays on. So it's a constant state of feeling anxious. Your focus, your attention, your energy levels, your muscles, everything is on hyper alert, and you're having difficulty turning it off, even though there's no danger, even though there's nothing you need to be prepared for. So anxiety by itself is not a bad thing, but it can be if it's inhibiting your ability to function, if you're not able to perform your task at work, if you're falling behind goals, if you are not getting your schoolwork in on time, if it's affecting relationships, then it becomes an anxiety disorder.
Almost reminds me of something that individuals talk about, stress and distress. That stress is not necessarily, control is not a bad thing, but distress becomes the bad thing.
Yes.
It's almost like you're saying it's the same thing with anxiety and anxiety disorder.
Yes.
So, how bad is it? Here in Antigua and Barbuda, in the region and in the world, do we have any sort of statistics about the incidence of anxiety disorders?
Well, with anxiety disorders in Antigua, I do not have access to any statistics. I am aware of some data in the United States, Canada, and certain parts of Europe.
Which we actually have, Dr.
Which we
Joseph,
have,
which we'll actually show our audience that in a very short time, in terms of statistics about anxiety disorders, basically.
Yes. Now, when you say mental health, most people picture the same type of person, somebody who is, by definition, psychotic or manic. They're talking fast, talking loudly, seem agitated, disheveled, unkempt, clothing soiled, or no clothing at all. But that's actually a very small part of mental health. Anxiety disorders are the most common mental health disorder in the United States, in Canada, and several parts of Europe.
Very common. How much can we extrapolate those figures from, for example, the US to, for example, here in the Caribbean and here in Antigua and Barbuda?
Well, and with the figures I'm going to give you, there's a little asterisk to them. We don't really know the true number of how many people are actually having anxiety disorders or mental health disorders, for that matter, because there are a lot of people still struggling in silence, particularly because of the stigma associated with mental health. What we do know is of the people who have come forward to say, I'm having an issue, a certain percentage have anxiety disorders. But in terms of the true number, we don't really know, and that's even in first world countries. In the United States, at least 30% of the population will experience an anxiety disorder in their lifetime. At any given moment, about 10% of the population has an active anxiety disorder, either seeking treatment, in therapy, medications, whatever it may be. The data is similar in Europe. It's about 14% across Europe. There are different types of anxiety disorders, and we'll also go over that later on. But some are more common in different ages. In terms of the gender that is affected, women are more likely to be affected by anxiety disorders, and that's regardless of where you get the data. In the United States, it's about 2 to 1. In Europe, it's reported as anywhere between 2 or 3 to 1.
Okay, all right, and our audience is now getting an opportunity to look at some of the figures that you mentioned. So, you're saying that the first bullet point there is that anxiety disorders are the most common forms of mental disorder.
Correct.
So you're saying, just to go back to what you mentioned earlier in terms of what are anxiety disorders, you're mentioning that anxiety is not a bad thing by itself because it's our body's way of being able to get things done.
Yes.
Let's say, for example, it puts you in a heightened sense of things. It gives you a heightened sense of your environment and so on.
Yeah.
But it's supposed to turn off itself after a point,
Yes.
after you get that thing done.
Right.
Anxiety disorder is when it doesn't get itself turned off.
Correct.
So the anxiety is always there, even when you don't want it to be there. It's there.
Yes, especially when you don't want it there.
Right. How does somebody, what are the risk factors for anxiety disorders? Is there something that predisposes somebody to having anxiety disorders?
So there are different things that can contribute to one getting anxiety. There is no set one condition or thing that can do it. The model that we use in mental health, it's a contribution from biological factors, psychological factors, and then social or environmental factors. And I can break these down in terms of components from each of them. So starting with biology, we'll look at genetics. One of the things that they've found that increases the risk of getting anxiety is a first-degree family member having an anxiety disorder. That increases your chances by about 30 to 65% of developing an anxiety disorder. It's not a guarantee, but it's one of the risk factors that makes you more prone to having an anxiety disorder.
What member of the family?
Parents, siblings, maybe aunts and uncles, but not much farther than that.
Okay. Once one of these has an anxiety disorder,
yes,
kind of makes you higher. That puts you at higher risk.
That puts you at risk. They have not identified a specific gene that's linked to anxiety disorders, but they've noticed an association with first-degree relatives for sure, possibly second-degree relatives.
So that means a kind of hereditary component to it?
Possibly. But it's also difficult because some of that may also be environmental. So if as a child, a parent has anxiety disorders, you're observing this parent who's always anxious, noticing how they do certain things, you learn how to do things the same way. So some of it might be biological, genetic, some might be environmental.
Extraordinary. We're going to be just giving you an indication that we're going to be going through an extensive, almost a kind of extensive tutorial by Dr. Chanel Joseph, because she's prepared several slides for us to be able to see what she's talking about. She's not going too deep into it, so don't worry. This is not, you're not going to become a mental health or anxiety disorder wonk when you finish this, but ultimately you'll get a better understanding, and she'll be showing that in terms of pictorial diagrams and so on. So we'll be having that presentation when we come back. We're going to be taking our first break now, Dr. Chanel Joseph. When we come back, much more about anxiety disorders. So again, we're going to be zooming in on the risk factors. And how do you know that you have anxiety disorders? What are the warning signs? When somebody is affected by that, how do they behave? Are there telltale kind of signs? And how do you make that? How do you make the distinction between anxiety disorders and something which is a little bit more innocuous? When we come out, much more on House Calls. The program is sponsored by Sagicor with the kind compliments of Pink Mongoose, responsible for our extraordinarily beautiful and resplendent floral arrangement here. And of course, another partner is A.G. Morgan. Please stay with us right here on all ABS platforms.
I had a really good time tonight.
So did I.
Life moves fast. Be prepared with Sagicor. Learn more at sagicor.com.
It's the return of GIS Presents, Monday evenings at 8, just got better. Well, join us for an exploration of how government institutions, policies, and laws work to serve you. That's every Monday at 8, right here on your station, the nation station, ABS.
This week on Conversations, we speak to Kenny Wilson.
Me and step and pick me up when you come back, because you always use me to say she's going to go for a walk so she can go see her boy.
Join me, Natalie Clark White, for Antigua and Barbuda's prominent people stories, and be inspired.
The National Youth Parliament Association of Antigua and Barbuda welcomes you to Manifesto Decoded, a series of panel discussions dissecting the political manifestos presented to the electorate of Antigua and Barbuda over the past 50 years. Join us on ABS Radio 90.5 FM and Facebook ABS Television Radio as the National Youth Parliament Association of Antigua and Barbuda raise awareness on the importance of political manifestos.
Sunny Sunday music to chase away your night blues. neo, soul mixed with a whole lot of jazz. Why not? Join me every Sunday evening from 6 to 10 p.m. and let's paint music in the night air. Press the refresh button for a new week. It's Natalie Clark White. That's me, Nat C. ABS 90.5 FM. The art in soul and all that jazz.
Let's get social. We're ready to connect with you. Find us on Facebook. Do you tweet? We do. Send us a tweet. Connect with us on Instagram. Keep up to date with news and more at www.abstvradio.com.
COVID-19 is debilitating and deadly. The disease has destroyed many lives and livelihoods and has now become endemic. The only way out of this pandemic to protect lives and restore economies is to achieve herd immunity through vaccinations. This is a clarion call for everyone to get vaccinated in protecting lives and livelihoods. Each vaccinated, all protected. Let's do it for tomorrow. Thank you.
Welcome back. You're in tune with House Calls. It's the Tuesday evening program on all ABS platforms devoted to ensuring that you're kept across crucial health information. And every week, we have a doctor who comes in to share their immense expertise and knowledge of their chosen area with us. And this evening, we're talking about mental health issues, and we're zooming in specifically on anxiety disorders. So anxiety is a good thing, but having an anxiety disorder, not a good thing. So we're discussing that issue with Dr. Chanel Joseph, who is a consultant in internal medicine and psychiatry. She's sharing that issue with us this evening. So Dr. Joseph, so risk factors, you said different risk factors, environmental, etc. We're going to be going through your extensive tutorial, we could call it, for the time being. So let's start off with, we've already finished the first slide, which is the incidence of it, the statistics that we have. You don't have any statistics for Antigua and Barbuda, but the closest we have is what takes place in the US and Europe. Yeah. So let's go on to our next slide, which is slide number 2 beyond that, and you'll just take us to that. Sure. There. Pretty much you would have completed this
So we've covered this slide. This is just, okay, so on this slide, this just shows the frequency of certain anxiety disorders, and this would be in the United States among adults. And these are in order in terms of most common. So the most common anxiety disorder are the specific phobias, so fear of snakes, fear of spiders, fear of flying. That's about 8 to 12%. Social anxiety comes in second at about 7%. Panic disorders, which is where panic attacks are commonly called, that's about 2 to 3%. Agoraphobia is fourth, also when you take into consideration adolescence. Agoraphobia is fear of leaving your home.
Okay, so open spaces and so on.
Yes. Right. And then generalized anxiety and social anxiety disorders are typically 1 to 2%. Now, the anxiety disorders that are more common in children are social anxiety disorder, separation anxiety disorder, and there's one that's not mentioned here. It's selective mutism.
What's that?
And that is where, so your child is able to talk, play, fully functional at home, but at school, they do not utter a word. Teacher will ask her, they do not speak. So in certain settings, they are mute. And it's usually a form of anxiety in that setting. So usually you have to figure out what they're struggling with. But that is one of the anxiety disorders you can see in children.
Selective mutism.
Yes.
I like that. All right, so the first one, specific phobia, yes. 8 to 12%. So that is what accounts for the highest individual reason for anxiety disorder, you're saying, essentially?
The most common type
most
of
common
anxiety.
type.
There's several different types of anxiety disorders, and there's a slide later on of those. But specific phobias are the most common anxiety disorder.
Okay, so people are afraid of lizards and snakes and, these little creepy crawling insects and so on.
Yes.
That's one of the main ones.
Yes.
All right, what are you afraid of? Tell me. We can talk about that later when we get to your audience participation through Facebook and so on. Are you afraid of, lizards or heights or thunder or lightning or so on? Or are you triskaidekaphobic, for example, afraid of the number 13 or anything that has to do with 13? Brontophobia, herpetophobia, and all of these different phobias. We'll talk about that later. So let's continue now with the slides on.
Okay. So this slide may cause some people anxiety, but I'm going to explain it as clear as possible. This is just showing that anxiety is a natural process based on use of our organs, primarily the brain. So anxiety is not something that is obia or it's not religious persecution. It's a chemical imbalance just like anything else in the body. Anxiety occurs because you sense some sense of danger. In this example, somebody's coming at you with a knife. You see this, and the eye is considered to be a part of the brain. So it sends a message to the brain, and that message goes to an organ called the amygdala. It's clearer on the right-hand side.
Yes.
The amygdala deals with emotions, it deals with memory. Think of it as your main danger alert network. So it sends an immediate message to the hypothalamus, to the pituitary. They then send the ACTH down to the adrenal glands, which sit on top of the kidneys, to make hormones, including adrenaline, norepinephrine. And that is where you get the muscle tone increases, the heart rate increases, the blood pressure increases, your focus, your attention increases. So it's multiple organs, but it starts with signals going through and from the brain. And that's just what this slide says.
And of course, adrenaline is the flight or fight hormone.
Correct.
Yes.
Correct.
So that gets you ready to be moving.
Yes.
All right. So essentially the neurobiology, as you said, of anxiety.
Yes.
So all of these different, but of course your brain is what marshals your response.
Yes.
Tells your body what to do.
So the amygdala is an important factor within the brain. The hypothalamus, the hippocampus, these deal with hormones, with memory. They also deal with triggering certain chemicals within the brain itself, such as serotonin. There's adrenaline within the brain, a chemical called GABA, G-A-B-A. They all play a role in the anxiety response. So the mechanism you're seeing on the screen is normal. What happens with an anxiety disorder is that this is a continuous process. It's supposed to just occur briefly and stop, but this just keeps going. It does not stop. So your adrenalines are constantly making hormones. Your brain is constantly making chemicals. Doesn't shut down.
Something is really wrong if that were to happen.
Yes.
All right, so that's a disorder. Can it also be a disorder if you're producing, if this process that you just showed us is not happening at all? So in other words, can there, almost like you have hypothermia and hypothermia, almost like it's a hypo and hyper, hyper and hypo. Can you also have that where you have this process not happening and so that's a disorder as well? Or it's essentially just, it has to be in that hyper state for it to be a disorder?
When it's in a hyper state, it's anxiety disorder. There are some syndromes where some of those organs are not functioning, because it also involves the cortex, which are the many folds in the brain, the temporal lobe, for example. If they get damaged, you have the opposite effect, where danger is coming at you and they have no response. And so it's actually, they don't survive. Because if there's danger and you're not responding to it, then they typically get killed.
Fair enough, fair enough.
So.
Well, yes, you actually clear that up, because anxiety is where it actually is in that state constantly.
Yes.
But the other end. I mean, I suppose this is, as you mentioned, a normal process because it is a way, there are some individuals who would tell you that who are evolutionists will tell you that humans evolved that way of ensuring that the survival of the species. Because if we weren't frightened when there was danger coming, then the species would have died off. I mean, we had to be frightened and run away or something like that. So that's fine. So, but the challenge now is when it's in that state, in perpetuity, a constant state of being anxious.
Correct.
All right, so let's continue now, Doc, in terms of the slides.
Okay. So as I mentioned, there are also chemicals within the brain that are moving in different parts of the brain. These are some of the chemicals. They're called neurotransmitters. And this is how the cells within the brain communicate. They release certain chemicals to each other. The ones of this table that are pertinent to anxiety are the acetylcholine, so the first one. And it's involved, as you can see, with muscle action and memory. So in anxiety, that's where your muscles are heightened, you get that muscle tension, and it also plays a role in remembering what had happened. The other one that plays a role is GABA. It's the fourth one down. It can affect your brain function, so focus, can also affect sleep. So as you're coming close to that assignment, it's on your mind, you need to get it done, your sleep level will decrease.
Right.
Norepinephrine is another neurotransmitter, and that communicates to the heart, which is why with anxiety you get increased heart rate, increased blood pressure. Also goes to the intestine, so that gut feeling that you get with anxiety, it's the adrenaline interacting with your intestines causing that sensation.
Good.
The adrenaline also is what helps the brain to focus, be more alert.
Yes.
And the most common, although it's at the bottom of the list, involved with anxiety is serotonin. And that is in several parts of the brain. It also is throughout the body, including the gut, which is why people with anxiety tend to lose their appetite. Some people get diarrhea. Some people even get nausea and vomiting. So these are chemicals that are operating within the brain. They trigger certain sections of the brain and will cause the physical symptoms of anxiety that we see and feel.
What about sweating?
Sweating, that would be the adrenaline.
Okay.
That would be part of the adrenaline, the norepinephrine.
Okay, so these are the physical manifestations of the anxiety.
Correct.
And you're showing us how these different hormones, for example, relate to that.
Yes.
Okay, all right. So let's continue now, because this is fascinating. This is extraordinarily fascinating. The way, for example, as I said, the brain's function has that effect on us physically. Okay. All right, there we go. We just had the other slide up.
So the thing with mental health conditions, not just anxiety disorders, is that there's no blood tests that I can do that will say you have separation anxiety, or there's nothing on an X-ray or CT scan that I can point to and say you have panic attacks. The way that the disorders are defined are through a manual called the Diagnostic and Statistical Manual of Mental Disorders, or the DSM.
Yes.
And this is they're at the 5th edition. There will be a revised version that should be coming out sometime this month. And so this is how we determine. It has a list of criteria, classifications of not only anxiety disorders, but mood disorders, personality disorders, even dementia. There's several conditions involving the brain that are defined in this manual. So this is what we use. Therapists, psychologists use them, psychiatrists use them to diagnose not only anxiety disorders, but all mental health disorders.
So that manual, you have a series of questions, I figure, and you'll be able to match certain traits and to track certain situations that happen to the person to determine what exactly, if they have an anxiety disorder. Is that the case?
Correct.
So for example, give me an example, please, Doc, if you can, in terms of what are some of the things that you'd ask somebody from that manual?
Well, typically, and we'll get to it later on with the psychiatric evaluation, but you really want to listen to what the person is telling you. Have them describe to you what they've been dealing with in their own words, without prompting, without any questions. And sometimes it can come to you as if the patient's read the book. So, for example, generalized anxiety disorder. It's a general feeling of just being tense. There's muscle tension, feeling on edge, worrying about everything. Those are literally the words that are in here. And sometimes patients will come and tell you these things, or they'll describe something very similar to what's in here.
Yeah, fair enough. So that book is essentially a psychiatrist's, or maybe the companion of a psychiatrist. They always have it.
The Bible of the psychiatry.
I was about to say today, we have a global audience which is very eclectic. So I was going to say a companion of it. Yeah. All right. So I look there at some of the questions that you would ask in some of the ways. We're going to get to that in a short while because we're going to get to the treatment and all of that and the diagnosis and the warning signs of anxiety disorder. And again, how do we know that you have an anxiety disorder as opposed to somebody who just gets a little bit stressed in a particular situation and it's not really a disorder? So we're going to make those distinctions kind of thing. Yeah. So, Doc, if we could continue with the slides, we'll get through those and then we'll get to some of those matters that we have to look at.
So on this slide, I've just listed some of the anxiety disorders. And you could take just one of these disorders and do an hour-and-a-half presentation by itself.
Wow.
But they're disorders dealing with trauma. So this is where you have post-traumatic stress disorder, or PTSD. There are adjustment disorders, so individuals who would have lost a close family member and are struggling with depression that's lasting more than a month. Reactive attachment disorder, so that one you will see in children who have not had appropriate time to attach to the mother through holding, breastfeeding, and so they struggle. It's a traumatizing experience for them to not have had that bonding. And so that's just one of them. There are also obsessive compulsive disorder, or OCD, and there are several categories of those. People who compulsively pull their hair or pick their skin. There's a show on A&E called Hoarders. Hoarding, that is a type of obsessive compulsive disorder. It is an anxiety disorder.
You don't want to throw away anything.
Correct. And to do so would cause anxiety. The separating from that object, no matter how useless somebody else might think it is, to separate from it causes anxiety. And you see that in the show, where a family member is trying to throw something out and they just go wild. Yes. That is anxiety, yes.
So that is, which one of those categories? That's
that would
OCD?
be under the OCD, obsessive compulsive type disorder, and there are several. A lot of people are familiar with the repeated hand washing, or people that do things in a certain number. So they'll only have even numbers of things, or they check the stove 3 times before they leave, and those, most people are familiar with those, but they're different types of obsessive compulsive disorder.
Yes, extraordinary. They call them idiosyncrasies in some way, but I suppose they could, if they might be a little bit more than idiosyncrasies in some cases.
Yes.
All right, fair enough. Interesting. Never thought of that. Somebody's always pulling their hair or sitting down and doing, doing their hand a particular way. All of that is part of it.
Yeah.
Extraordinary. Those are all disorders that you showed us about?
Those are each, so there are, so trauma and stress-related disorders is the category. Within that category, you have several different types. And then you have obsessive-compulsive disorder. There are also types within those, including anxiety disorders that can be caused by substance use or by a medical condition. And there are even more anxiety disorders than what's on the screen. So this is just
the tip of the iceberg.
The tip of the iceberg. There's quite a bit more.
Extraordinary. All right, so there we go. So look there at some of those anxiety disorders. I'm particularly interested in the OCD one and, of course, the trauma-related one. PTSDs are, a common one. Let me ask you, before we actually move on to our next slide, would the PTSD come in, for example, where some individuals would have lost a loved one, and when it comes around, for example, on that date, around that date every year, they go into they have some sort of challenges or anxious feeling? Is that considered PTSD sort of situation?
That is part of it. So other factors where you can suspect PTSD is hypervigilance about the event. For example, if a family member got sick, was in the hospital, you went to visit them every day, and every day they got worse. You saw them getting worse. They're intubated in the ICU on a bunch of machines. It was traumatizing for you to experience. Eventually, they died. 2 months later, somebody else gets sick. You don't want to go to the hospital. I will not go. So trying to avoid the place where it happened, trying to avoid a similar situation, there's a lot of avoidance. Sometimes you're watching a show and you might see somebody on the show, completely fictional, get intubated, end up in the ICU. That triggers the memory. So there are a lot of flashbacks, a lot of nightmares. So they have trouble sleeping, wake up screaming, and it's constantly engrossing their thoughts. So it's not just the anniversary. The anniversary is a big one, but there are other things that could lead you to think possible PTSD or post-traumatic stress disorder.
Okay, interesting. We're going to come back to that a bit later on. We will get to the warning signs and
Yes.
so on. All right. So our next slide now will take us further.
Okay. So this is just a quick definition of some of the anxiety disorders. And as we already talked about, there are several.
Right.
So there is social phobia. And this is where there's an inappropriate amount of fear of going into a social setting. Usually it's because there's a fear that you're going to embarrass yourself in some way. You're going to say something and get laughed at, or you're going to trip and fall. And because of that, these individuals tend to want to stay at home. If they do go out, they're profusely sweaty, they have a tremor, their voices are shaking. And that one is actually pretty common. The specific phobias we actually talked about, so fear of snakes, fear of flying. If you've heard of medical students that first day in surgery, they did the open cut and the student just passed out. It's usually a fear of blood, but they didn't realize until that moment.
So people have these phobias and they don't realize?
Yes, and that's
Until
usually
they realize.
once they're exposed to
Yes,
it.
they then realize.
Yes.
Well.
We talked briefly about the selective mutism. So it's where it's usually in children, they can speak, they know their language, but in certain situations, certain settings, they're completely mute. They will not speak. It's usually a sign of anxiety. And then separation anxiety is fear of being out of the presence of someone. And it's usually because it's a fear that something is going to happen to them if they're not in your presence. If you can't see them, you assume or fear something bad is going to happen to them.
I want to ask you two things about this, Doc, if you can. I mean, I'm particularly intrigued about the selective mutism. It's almost like some parents are wondering if it's the same child, if it's their child, because they have the child who is so talkative and sociable at home, and then when they go out in a particular setting, they just shut down completely. They're wondering if it's the same child. But the fear of public speaking, there's some people who are mortally afraid. I mean, they're absolutely morbidly afraid of speaking to an audience. So when they're to, for example, go up to an audience and to speak, they start to have these almost convulsions almost. So that's one of these that we talk about. The social one.
That would be the social anxiety.
Okay, there we go. All right, so we can continue now with our slides. Let's get through the slides quickly, and then we take the other break. Then we're going to come back to the issue, for example, about the warning signs and so on.
Sure. So these are just other types of anxiety disorders. So we talked about generalized anxiety, just general worrying about day-to-day activities. We talked about the obsessive compulsive disorder, or OCD, as it's commonly called. When you're leaving a room, you have to flick the switch 5 times before you leave. Or usually it's a fear that if you don't do it, World War III is going to start. It's usually something out of proportion. The post-traumatic stress disorder, or PTSD, we talked about briefly, and that is linked to a traumatic event. Yes. And it's not just war, trauma is anything, as long as it's traumatic to that person. Panic disorders, where the anxiety builds up to a point where it's severe, they get a massive attack. So think of it as adrenaline overdrive. Their chest hurts, chest tightness, shortness of breath, shaking, Some people, their vision, they get tunnel vision, and sometimes with a panic disorder or panic attack, they pass out just from the overload of all the chemicals that's peaking.
How common is that one? Just before you continue the last one, how common are the panic attacks? Because, I mean, I understand is anecdotally, quite a few people have those every now and again.
Yes, it's quite common. Most people with panic disorders or panic attacks are aware that it's coming. They can feel it building, and they tend to leave the environment before they collapse. But some people do. It's relatively common. I think it was about 2 or 3% or more on the slide that I had showed before.
Yes.
Usually it's not something that they're aware something causes it. They're sudden, unexpected attacks come out of nowhere. And so it can lead to agoraphobia, not wanting to leave your home. Because if I don't know when this is going to come, there's the fear that it's going to come when I'm outside of my home, and then where do I go? Who do I call? And so they tend to travel together, panic disorder and agoraphobia.
Oh, I see. And of course, the kind of opposite to agoraphobia is claustrophobia, which a lot of people are claustrophobic.
Yes.
I mean,
nice.
I mean, just, you know, confined spaces, that is, you know, fear of confined spaces there, that's mortally afraid of confined spaces. Continue, please, Doc. There's one other on this line that we didn't quite mention. The social anxiety.
The social anxiety, we talked about that. That's feeling anxious in a social situation. So you're afraid you're going to say something embarrassing or that something's going to happen. And so you would like to avoid the situation. Sometimes you can't. And when you have to, it's physically visible. They're very uncomfortable. They don't speak much. They tend to want to isolate even in the social situation. You have to go to them. They won't start a conversation or approach you.
Of all these, Doc, of these 5, which one is the most common in your experience?
Panic disorder. I would say panic disorder. Yes. I haven't seen a lot of social anxiety. I have seen an increasing amount of PTSD during the pandemic. Oh. But there's panic disorders are still at the top of what I actually see.
COVID-19 has affected a lot of people in so many different ways.
Yes.
Apart from the infection part of it when you actually get sick with COVID-19, but just the mental impact of that has been tough for some people. So it has actually caused some of these things that you're
Yes. So in the healthcare workers, particularly the emergency room physicians, who are the frontline workers, they deal with these sick patients firsthand. Sometimes they die right in the emergency room, and you don't really have time to process that you're on to the next person. And so you're being traumatized by people dying around you, and for 2 years haven't really had time to process. So unfortunately, a lot of healthcare workers are in therapy or on medications or self-medicating, alcohol, illicit drugs, just trying to deal with what we've all been through the last 2 years.
We're going to talk about how people try to deal with anxiety disorders, which might be a challenge in itself, because sometimes in dealing with anxiety disorders, people use, you know, substance abuse becomes an issue.
Yes.
So for example, some people, I'll tell you, for example, in journalism, former colleagues of mine would say, look, I mean, almost every journalist has a vice. Some have smoking as a vice, some have drinking as a vice, and I mean, overconsumption, that is. And then that becomes a way for them to deal with the stresses of a very, very tight schedule and, you know, always against the clock and so on. We're going to talk about that in terms of the substance abuse separately. Or next slide, Doc, in the meantime.
So we touched on a bit of the symptoms of anxiety, but these are just some. There are a lot more. So just going from head to toe really quick. With anxiety, it comes back to the fight or flight response that you had mentioned before, where your brain is hyper-focused, you're on alert, this constant feeling of impending doom or danger. As a result of that, that can occur at night. You're not getting enough sleep, your body is not relaxed, you're having muscle tension. A lot of people get that muscle tension, the back of the neck, back of the shoulders. With the adrenaline surging through you, your blood pressure can go up, heart rate can go up, the sweating in the palms. With that, you tend to breathe harder, breathe faster. The adrenaline in the intestines can cause that discomfort. Like I said, some people get nausea, vomiting, diarrhea. Stress causes weight gain, and that is because of the hormones that are released by the adrenal glands that sit on top of the kidney. Those chemicals also affect your blood sugar. So a lot of people who are stressed, and the diabetics can probably relate to this, when they're stressed, their blood sugar goes up, even though their diet hasn't changed. One thing that people are not aware of is that anxiety can lower your immune system. So just being anxious can make you prone to having an infection. And one of the reasons that we'll get a male patient in to see me for anxiety is if there's sexual problems. So if you're tense to the point where you can't perform with your significant other, that's usually a time they will come in and want to discuss how they're feeling and what's been going on. So those are just some. There are a lot more, but those are the main symptoms to pay attention to. If you're struggling with any of these, you may have anxiety.
Extraordinary. It's amazing why I mean, we've touched on this issue before about the, a thread that runs through so many of these programs. Men often do not want to check on their health, and I get the impression that perhaps it's the same thing in terms of mental health. A man would not necessarily run to you, Dr. Joseph, to find out, look, I'm having some anxiety disorder issues, until possibly, as you mentioned, there are some libido issues.
Yes.
It affects his virility. All right, I think we can continue just to finish off the slides and then we go to our next break.
So we had touched briefly on the biosocial, psychological factors that can put you at risk for anxiety disorders. So we talked about the genetic component, first-degree relatives, but there are also environmental factors. So certain prescription medications can increase anxiety because they can trigger some of the response that you have with anxiety. So inhalers for asthma, tend to cause an increased heart rate based on how it works. Certain medications for migraine that have caffeine in them can cause increased anxiety. Stimulants that are prescribed for ADHD, attention deficit hyperactive disorder, can also cause anxiety. Certain herbal medications can also trigger anxiety. Green tea and green tea extract products, for example, can increase anxiety.
Really?
Yes. And herbal...
Green tea?
Green tea, yes.
Interesting.
A lot of teas have caffeine in them. So the teas with the higher caffeine content can trigger anxiety. There are also herbal medications or teas that are used to help with weight loss that have a chemical called guarana. They tend to try to speed things up, speed up your metabolism, but in doing so, that speeding up can also mimic or cause anxiety.
Oh, interesting. What about coffee?
Coffee definitely can. Yeah.
Interesting. So be very careful of your consumption of coffee. As with everything, moderation is key. We're going to talk about some of the issues with coffee a bit later on. But yes, Doc, you were going through some of the other issues with that.
And then we spoke before about substance abuse. So individuals who are using illicit drugs, whether it's to feel something different or recreationally, some of them can cause anxiety. Alcohol by itself reduces anxiety. It works the same way as some of the anxiety medications do. The problem with alcohol is once it's out of your system, it causes rebound symptoms, rebound anxiety. So it's not when you're drinking, it's once you're sobering up that people tend to have anxiety. Okay.
So people talk about drinking away their sorrows, but then the sorrows come back.
Yeah, it's just temporary. They come back once you're sober up.
Interesting. And I suppose that there's a recurring cycle, and there now is a vicious cycle because to try to repress those problems again, you drink more.
Correct. It's not a comfortable feeling. And so a lot of people, when they are continuously drinking, it's not because they enjoy getting drunk or because they even like it. It's to prevent the withdrawal and all the symptoms that comes with it, including the anxiety.
Extraordinary. All right. Yes, Doc, you're talking about now some psychological and developmental issues.
Yes. Experiences you have as a child can cause anxiety, and some of them are listed there. So if there's a history of abuse or neglect, whether there's emotional or physical abuse, if there's any history of sexual violence, and some of these are also valid even as an adult. But the younger you are when they start, the more it can trigger anxiety.
Yes.
Chronic illness is another one. If you're constantly fighting an illness, you're doing your part, you're following the doctor's orders, nothing is working, you get anxious watching the disease progress. Death of significant other is considered to be a very traumatic event. Separation and divorce is considered to be traumatic with children especially, and with adults, just financial difficulties. And I'm sure there are a lot of adults who can identify during this pandemic struggling with finances, getting that anxious feeling of where am I going to get funds from? How am I going to make ends meet this month, etc.
Especially when, for example, as you see the day is getting by, you have a bill to pay, and the time is getting near for the bill to be paid, and you're not seeing the money.
Yes.
There you go. So that would cause some anxiety. All right, so these are some of the factors that you're saying, biological as well as psychosocial, which impact on anxiety.
Yes.
All right, I think we have just a few more slides to go.
Yes. And so typically, what I would recommend, or what people should be doing, is you want to get in touch with your general practitioner or your primary care physician and just have a full physical examination. You want to make sure that there's not something physical going on that's causing an anxious feeling, because there are medical conditions, like I mentioned, diabetes and the extremes of the blood sugar can cause an anxious feeling. So have your blood pressure checked, your heart rate checked. They'll physically examine you. Typically, blood tests are also recommended. So the cell counts, checking your kidney function, your electrolytes, the blood sugar, liver function. The thyroid is very important to test, and the urine drug screen, just to see are there any illicit substances you may be taking that might not have been disclosed in the history that could be contributing. If physically there are no issues, the medical blood tests, urine tests are all normal, then a referral to a psychiatrist is typically the next step. And typically, I spend about at least an hour for the first visit with my patients. In the psychiatric evaluation, you really want to start off by just listening. Have them describe what they've been feeling. Ask a few questions to get more information. So how long has this been going on? Things that they've noticed makes it better or worse, triggers, and that will sort of help guide as to what type of anxiety disorder that you might be dealing with. In my evaluation, I also take into account the medical history, and if the physical exam, the blood tests haven't been done before, as internal medicine, I would also start with those to rule those out before going into recommending psychiatric treatment.
I just realized that what you do, your two areas of specialization work very well together.
Yes.
Because internal medicine, you're dealing with the biological side of things, and psychiatry, you're dealing with the mental side of things.
Yes.
Very, very good. I mean, you chose those excellently. Good job. When we come back, we're going to take a quick break now, Doc. When we come back, we're going to be turning our attention to finishing up the slides. But again, the warning signs. We're going to get to that. The warning signs of anxiety disorder. And how do you know that, look, it's anxiety disorder as opposed to something else? Is it more harmful? Is it a little harmless? Is it just you just having a problem with a particular situation, or do you have a real disorder with anxiety? When we come back, the program is sponsored by Sagicor with the kind compliments of Pink Mongoose and A.G. Morgan. Pink Mongoose has again produced an extraordinary collection for us this evening, and they are outdoing themselves every week. Just look at that. Just look at the array of colors. Extraordinary, their floral arrangement this evening. I didn't even know it had so much detail. Good job to the camera team for getting such detail for the floral arrangement. It looks far less detailed to me, right? Looking at it right here, right, Doc? But it is exquisite. So Pink Mongoose, thank you so much for ensuring that our set is normally resplendently adorned to compete this evening with Dr. Chanel Joseph. When we come out, much more on House Calls. Stay with us.
Life moves fast. Be prepared with Sagicor. Learn more at sagicor.com.
Wednesday marks the beginning of Lent, and Antigua Barbuda today is front and center. We will be sitting with Reverend Maurice John of the Moravian Church. Also on Wednesday, we look forward to World Consumer Rights Day when we focus on digital finance. And Joyan and I will also bring you the Wadadli Roots pop-up shop. Take it from me, Steve. Antigua Barbuda today, 6 a.m. to 9 a.m., and it's all here.
This week on Conversations, we speak to Kenny Wilson.
Me and step and pick me up when you come back, because she always use me to say she's going to go for a walk so she could go see her boy.
Join me, Natalie Clark White, for Antigua and Barbuda's prominent people stories, and be inspired.
The National Youth Parliament Association of Antigua and Barbuda welcomes you to Manifesto Decoded, a series of panel discussions dissecting the political manifestos presented to the electorate of Antigua and Barbuda over the past 50 years. Join us on ABS Radio 90.5 FM and Facebook ABS Television Radio as the National Youth Parliament Association of Antigua and Barbuda raise awareness on the importance of political manifestos.
Welcome back. I know you were anxious to have us to rejoin us. Not anxiety disorder, but you were just anxious. This is a good thing to have us rejoin you. All right, so we're talking about anxiety disorders this evening, and with us is Dr. Chanel Joseph. Dr. Chanel Joseph is a consultant in internal medicine and also in psychiatry. And as I told her before we went to the break, that is a really good nexus because it allows for her to be able to look at both the biological as well as the neurological part of things in relation to addressing anxiety disorders. So Doc, just before we went to the break, we were just finishing off on the slides that you had, and then we're going to get to the warning signs. So if we're going to go right into the slide, we have about 3 more.
Sure. So the reason why it's important to do a comprehensive medical examination is because there are certain conditions that can mimic anxiety disorder. For example, a tumor in the adrenal gland. And a common one is a pheochromocytoma. It causes release of the same adrenaline and other hormones that cause anxiety. So it's important to rule that out. Asthma can cause shortness of breath, some chest tightness, symptoms you can see with anxiety. Atrial fibrillation is an irregular heart rhythm that can also mimic the palpitations you can sometimes get with anxiety. It's important to check on the thyroid because the thyroid hyperfunctioning, which is called hyperthyroidism, can cause an anxious feeling, tremors, excessive sweating. So it may be your thyroid needs to be checked rather than having an anxiety disorder. The alcoholism we spoke about, primarily the withdrawal. Delirium is a medical emergency characterized particularly by confusion. Sometimes there's an infection, but it can cause increased heart rate, increased blood pressure, symptoms that can mimic anxiety. Diabetes, the extremes of the blood sugar can also cause anxiety symptoms, and of course the substance abuse that we spoke about. Use of cocaine, methamphetamines, excessive caffeine can mimic anxiety disorder.
So you're saying that these issues have to be ruled out first before we get to an anxiety disorder diagnosis?
It's helpful to rule them out. Some you can rule out just from the history. For example, it's unlikely to have diabetic ketoacidosis if you don't have diabetes. But it's just things to keep in mind that you'd want to make sure is not playing a role before you diagnose someone with an anxiety disorder and put them on that track of treatment when it's actually something medical.
There you go. That would be something.
Yes.
That is one of these things that somebody says, well, you have anxiety disorder. And it's not.
And it could be something
That would be
else.
extraordinary. We have 2 more slides now. Yes. The next one, please.
So in talking about treatment in mental health, there are two main treatments that are available on the island. Psychotherapy or counseling is one of them, and medications. Typically, I would recommend psychotherapy. The way it helps or the role it plays is to determine where the anxiety is coming from. Is it an actual fear of something that could actually harm you, or is it just a thought or a belief that's sort of overtaking your mind? And a therapist can work with you. They can go all the way back to your childhood, look at your history. Was there trauma? Was there something that could have sparked the anxiety? Have you just been living with it all this time and now it's to the point where you can't manage?
Yes.
Cognitive behavioral therapy, commonly called CBT, is the most common type of psychotherapy used with anxiety disorders. The psychodynamic therapy is where they go back to your childhood, see if there's something traumatic there that could be linked to. Biofeedback and exposure therapy works with phobias or individuals who have difficulty leaving their home. If you have a phobia of getting on a plane, a therapist will go with you, take a drive to the airport one day, then walk through the door the next week, and go to the counter. So it's a gradual process to sort of
more comfortable.
walk you through the process and see that that intense fear is really nothing's going to happen as you go through the process.
So when you're afraid of a snake or a lizard or cockroaches or whatever some people are, morbidly afraid of, how do you work with that? Do you have some toy lizards and, get somebody to touch it or something?
Well, I have a phobia of snakes. I don't even like to see them on the television. Some of them you don't have to work through. So if you have a fear of snakes, that's not necessarily something you want to get rid of.
True.
So it depends on how the anxiety disorder is affecting your life. So if what you're anxious about is keeping you from getting to work, staying on task at school, interfering with your relationships with family members, then it's something that should be addressed.
Okay, fair enough. But the snake one can...
You can leave the snake one.
Yes, it's true. Not a problem with having a phobia there.
So the other part of treatment is medications. The main treatment for anxiety disorders are the antidepressants. And the antidepressants primarily work with serotonin in the brain. Some work with some of the other chemicals. But they have been shown, and these are studies in the US, in Europe, to be beneficial in treating the symptoms of anxiety. Okay. There are other classes of medications, the benzodiazepines, the common names people may be familiar with, lorazepam, clonazepam. They work very well for anxiety when there's severe anxiety, panic attacks, severe fear of leaving your home. Some people will take a benzodiazepine about 30 minutes before having to leave their home. It helps them to get through the door. The antidepressants are more long-term. It takes about 4 to 6 weeks to see the full effect of the antidepressants. You might notice the effects in the first 1 to 2 weeks, but it really takes about a month, month and a half to see the effects of an antidepressant.
Okay.
There are certain blood pressure medications that can be used to treat anxiety. For example, you mentioned fear of public speaking. A lot of people are prescribed propranolol. It is a beta blocker to take 30 minutes before having to give the presentation. What it does is, in the moment, although you're anxious, it keeps your blood pressure, it keeps your heart rate under control. So yes, you're anxious, but you're not feeling it, and so you're able to get through the process. Certain antihistamines, hydroxyzine or even Benadryl, are used for anxiety. Those are particularly good for people who have anxiety that manifests in skin issues. Some people itch. There are some people that will break out in hives all over just from anxiety. And so the antihistamines are helpful in reducing the anxiety, but also reducing that histamine effect that causes the itching and the rash.
Yeah, I don't know about the hives for some people, actually, when they get anxious. I know you're anxious to call, by the way, talking about anxiety. In a good way. 4622996, 4622996, and we'll be able to get your questions answered. Also on Facebook as well, if you want to get your question answered, put the question there. We'll get to the last slide in a short while with some of the other medication and so on. But yes, you can prepare to call from now on. 4622996, a burning question, for example, about your anxiety, about phobias, how do you deal with them and so on. Please, you can call now. Yes, Doc, the last slide.
So the last slide is just a list of antidepressants that have been shown to be beneficial in managing anxiety disorders. And this actually came out of Europe, in Germany. Some of these medications are available on the island. The paroxetine and sertraline are available through medical benefits. The private pharmacies are typically able to provide the others, escitalopram, venlafaxine, and they're all beneficial.
All available here?
Yes.
Okay.
So they're all beneficial in different ways. Unfortunately, there is no trick to knowing which one is going to be the right one for you. Some medications are given based on the symptoms with the anxieties. If bothering your sleep, your appetite, you can direct the medications based on what's going on with the anxiety.
Yeah. Doc, could you hold one second, please? Sure. We're going to come back to it. Let's take our first call this evening.
Sure.
Good evening. Thank you so much for calling us on House Calls. Go ahead, please. You are our first caller. Go ahead, please.
Hi, good evening.
Good evening. How are you?
Okay, very informative program.
Indeed.
Yes, I would like to ask the doctor a question. I have a son who is 29, and I don't know if it's a mental problem he has, but sometimes, or it's anxiety, but sometimes he most of the time, like, he don't sleep, and he speak to himself, and sometimes he just burst out arguing by himself, and all different sort of things I'm watching, because I always watch and see. And I would really like you to tell me, or if you can answer the question for me and to help me to find out what it is, if you have any idea, or who can I speak to, because I tried a lot of places and I'm not getting any help. So I really would like to find out if you can help me, please.
Hold, please. He said he's 29.
Yes, 29 years old.
29 years old. You got the entire question now? You got what you were saying?
I got the question. More information is needed. For example, someone talking to themselves, it could be anxiety and isolation and needing to get something out. And so they're talking to themselves. Someone talking to themselves can also be hallucinating. They're seeing or interacting with something that no one else can see. And so more information will need to be gathered. Seeing the individual is also very helpful to get the information from their perspective. And as I mentioned before, ruling out any medical problems is also important. So a good place to start, if it hasn't been done already, is getting in touch with a medical physician, if he has one, and getting him physically examined. If all that is done, nothing is found, then scheduling an appointment with a psychiatrist would be the next step, getting a psychiatric evaluation, and then from there, you get a diagnosis, and the diagnosis will determine what the treatment is. So a lot more information is needed, but I would say start with the medical evaluation. Once that is done, get in touch with a psychiatrist.
Excellent. Thanks, Doc. We hope that the caller had her question answered. If you wanted to possibly have a follow-up, you can call us back as well. 4622996, that's the number to call. Doc, we were talking about that slide, and of course, questions on Facebook as well. And in fact, let's go to Deli Kelvin. We're going to come back to the last slide in a short while. But Deli Kelvin asks, can anxiety impact young persons to having it at the age of 18 years old? And why are the reasons that anxiety disorders could threaten to attack persons' mental well-being? All right, let me see if quite a bit to unpack in that question. So firstly, can anxiety impact young persons so that you could have it between 9 and 18 years old? Let's deal with that first. And then, of course, the second part is, why is it that anxiety disorders could threaten to affect your mental well-being?
Okay. So yes, anxiety can impact individuals as young as 5 or 6 years old. It is thought that anxiety disorders begin in childhood as adolescent age, primarily because of the environment at that time. So what was the household situation like? How many people were in the household? Was anyone in the household disabled? And it might sound strange, but having someone with a disability in the home can take away attention from the child. Or if you're frustrated dealing with someone with disability, you take it out on the child. Was there a separation by the parents? Was there divorce? Was there abuse? So anxiety can start as young as 5 or 6 years old or even younger. In terms of why anxiety
How is it that it can actually impact your mental well-being?
Your mental well-being. It's pretty much consuming your mind. There's different types of anxiety disorders. Generalized anxiety, you're worrying about everything that you have to do every day for the next 2 weeks. And you still have to sleep tonight, but you're already 2 weeks out. There are a lot of people who have anxiety disorder. They have an event coming up or something they need to do, and there's a fear of failure. Having such heightened anxiety, it not only affects you mentally, so things are happening around you. There are family events, you go to church, but you don't hear half of what is going on around you because you're in your own head. And so some people with anxiety, because they're so hyper-focused on one thing, they think they have dementia because they're missing everything else. It's just a feeling of not feeling well, of feeling that you're not accomplishing anything, feeling overwhelmed. And it's not only affecting your mental well-being, it's your physical well-being. People can lose weight. It can trigger having medical conditions that now need actual medical treatment for the rest of your life. And this constant state of being overwhelmed, unfortunately, can lead to suicide. It gets to a point where people are so overwhelmed, they're focused, they can't think, and the only thought that makes sense is that suicide will give some relief. And so it's important to address mental health disorders, anxiety just being the most common one, because these people can be saved. It is anxiety disorders, mental health disorders are treatable, and it can help to improve your quality of life by getting them treated.
Excellent. We're going to come back to that point because you wanted to underline that point about
yes.
You shouldn't shy away from mental health issues and see them as a taboo subject and just kind of brush off something as just somebody else acting up. We should actually address it. Let's go back to the telephone lines. Good evening. Thank you so much for joining us on the House Calls. Go ahead, please. Hello, good evening. Good evening to the caller. All right, the caller is not hearing us. Good evening to the caller. All right, we asked the caller might be listening to his or her television or radio, and as a result, they're not hearing us. So, caller, I hope that you are eventually, caller, good evening. All right, not there at all. All right, so we will continue with another call shortly. And of course, Facebook questions and comments as well. Let's go back to this one. Chris Stevens asks on Facebook now, can anxiety impact upon one's blood pressure, and what home remedy can be used to reduce the anxiety? So, can anxiety impact upon one's blood pressure? What home remedy can be used to reduce the anxiety?
So for the first question, yes, anxiety can impact your blood pressure. It comes back to the chemical response triggering your adrenal glands, and then adrenaline or norepinephrine gets into your bloodstream, increases your blood pressure, increases your heart rate. I am aware that a lot of people prefer natural remedies. There are certain natural supplements that can actually help anxiety. Valerian root is one of them. It's also used for sleep. There is also a supplement called Kava, K-A-V-A, that can help with anxiety, but you have to be careful with Kava because it can affect your liver function. Those are just two of the natural supplements. In terms of what you can do at home, not everything has to be a supplement or a medication. There are also things that you can physically do to lower your blood pressure, lower your anxiety. One of them is deep breathing exercises. And a lot of people may think they're familiar with it, but most of the times people do it wrong. In the height of anxiety, they just rush to a chair and then they say it's not working. Yes. But you actually have to change your environment. How you're sitting is important. So find a quiet room if you can. I always tell people, go to the bathroom if you need privacy. Nobody's going to barge on you in there. And make sure that you're seated with your feet flat on the floor. You want to relax your arms, so not across your chest. You want to relax them on the armrest if you have one, or just straight down. And you want to take deep breaths. Typically, I recommend you breathe in for 5 seconds, hold it for 5 seconds, and then breathe out for 5 seconds. And you want to repeat that process for several minutes, 5, 10, 15 minutes. Because your anxiety normal network is hijacked, your muscles aren't relaxing. So you have to physically, with your mind, tell your muscles to relax, because a lot of people tend to have tense shoulders and into the neck and don't realize that they're doing this. And so you sometimes have to physically relax your muscles in your neck, in your arms, and just keep breathing. And that is something you can do without medication, without supplements. It comes with practice, so you're not going to master it on the first try, but it's something that has been shown in studies to be beneficial.
Doc, that was some sage advice. We're going to talk a little bit more about that. I mean, this is very practical advice. But I'll tell you about house calls, it's about ensuring that you're able to, you're sitting in the comfort of your homes and getting this extraordinary information that otherwise you don't have to go to a doctor about. How wonderful is that? Good evening. Thank you so much for calling us on House Calls. Go ahead, please.
Hello. I just have a question to ask.
Sure.
I have a strange phobia, and it's not really a base question, but I'm afraid of lizards and frogs a lot. What is something I can do to get over that?
So you're afraid of lizards and frogs?
Yes.
Okay. Yes, Doc.
So
thanks for the call.
Thank you for the question. This is where the exposure therapy would come into play. So if you really want to get over that phobia, it would come back to purchasing toy or plastic, rubber, frogs, lizards, getting comfortable with them, hold them in your hand. Once you've mastered that, because even just doing that can trigger some anxiety, or you'll notice your heart rate is a little bit up. Once you do this enough times and you're comfortable with it, then go outside. You can maintain a safe distance, but just look at a lizard or a frog. Get comfortable doing that. You can do it from the safety of your home. And once you get comfortable with that, take a few steps outside. Try to increase your distance and see how well you do, but it's a gradual process over time. I'm not sure if you want to hold a frog or a lizard, but if that is the goal you want to get to, then that would be the next step.
That's extraordinary. And please, to the individuals around the person, please do not pull a prank on the person.
Please.
Throw a frog on them or a lizard, whether it's a live one or a rubber one. Yeah. Do not do that.
That will worsen the disorder. That will not help.
Let's go back to the telephone lines now. We're going to come back to that. Good evening. Thank you so much for calling us on House Calls. Go ahead, please.
Hi, yes, good evening.
Good evening to you.
Yes, I'm the first person that called a while ago.
Okay, sure.
About my son.
Right.
And what I wanted to ask the doctor, who is available to help in that area? Because I've been trying, God knows, and I just can't get no help. And I really need to help out my son, because most of the time, as I said, he will burst out. He will burst out like arguing to himself and saying, like things like, "Yeah, leave me alone. Yeah, leave me alone." And sometimes I ask him who is troubling him, and he say, "Them people," but I don't know who them people. I don't see anybody. So sometimes I'm scared, but still, because of he's my son, I'm trying my best to deal with it and to help him, but I really need to know where I can get help, where I can get some help, so I can help my son get back on track if he can, which I believe he can.
Yes.
And he smokes too, so sometimes I have to give him, sometimes just to calm him down. Because if I don't give him, he don't calm down, and I'm really scared.
Hold the line, please, caller. I'm going to ask Doc to speak with you so that she can get the information that she wanted. Doc, you can relate to
So, I know in terms of a psychiatrist, there's myself, there's also Dr. James King. What I will do, I will give you my number, and I would like you to give me a call, and I'll assist you in getting him evaluated, whether it's by myself or Dr. King. My number is 464-9095. And so just give me a call. It's 464-9095. And I will take further information and work with you to figure out what would be the best place and the best person to assist you and your son.
Okay, thank you.
You're welcome.
All right, thank you.
Really appreciate it. Thank you so much. And we certainly wish you all the very best in trying to get the information. Dr. Joseph is going to ensure that you get all the best help that you can possibly get. Going back to Facebook now, what is social phobia, panic disorders, and generalized anxiety disorder?
Okay. So those are three separate types of anxiety disorders. Social phobia is a fear of going to social settings. So you're invited to a party or you're invited to go to the movies, and there's usually an explanation or a reason that you can't go. I'm washing my hair, I have to walk the dog, I'm not feeling well. You're constantly being invited to social gatherings and you just can't make it. It's actually a fear of a social setting. Usually it's because of a fear of embarrassing yourself for some reason, or thinking that something bad is going to happen if you go to this event. Panic disorder is where you suffer from repeated, unpredictable, severe anxiety attacks. It can last for several minutes, and there are a lot of physical symptoms with it. So chest pain or chest tightness, shortness of breath, excessive sweating. There's also an impending feeling of doom. A lot of women show up to the emergency room with panic attacks and swear they're dying from a heart attack. You do the blood test, the EKG, the heart is completely normal. And they tend to show up more than once. They'll show up like once a week or twice a week for several weeks, and they'll swear they're having a heart attack. Once you do the test, they always come back negative. And so the emergency room doctor will start to think, okay, is this a mental health disorder? Is it anxiety? Is it panic disorder?
Yes.
Generalized anxiety disorder is just worrying about everything. So you're going to bed tonight, but you can't sleep because you're worried about, I have to get up in the morning, what am I going to wear to work? I have to get the kids up for school, I have to get them there early, I have to get to work, I need to leave work at noon to go and pay this bill, I hope I make it back to work on time, what am I cooking for dinner tomorrow? And you still haven't even slept for tonight yet,
yes,
but you're already at dinner tomorrow. And having all of these thoughts, you're constantly on edge. So generalized anxiety disorder typically cause muscle aches, muscle tension, typically in the neck and the upper back, but you can feel it in the arms, the legs. Individuals with generalized anxiety are very tired because everything is just on edge. It's continuous level of anxiety.
All right, Doc, we have about 3 more minutes left in the show, and so we want to take about 2 more calls, 4622996. So if you have a burning question, a burning issue that you want to talk about, 4622996. I also want to talk about this issue. Just before we go to, let's go, Damien. So we'll take one Facebook question, and then I'll come back to another question about warning signs. So Chris Stevens asked, is the fear of falling or the fear of, fear of failing or the fear of being in the spotlight a form of anxiety? If so, how can one deal with such? So the fear of failing or the fear of being in the spotlight, is that a form of anxiety, and how do you deal with it?
So it is a form of, so it is anxiety. It becomes an anxiety disorder where fear of failing or fear of not wanting to be the center of attention causes you to avoid certain opportunities, certain experiences. You're missing moving up in your job because you're shying away from opportunities, which would require you to be in the limelight. What was the second part of that question?
A fear of failing or being in the spotlight.
Yes.
And how can you deal with it?
So how you can deal with that is psychotherapy. There are medications that you can also take ahead of time, just as needed. Before, so if you know public speaking is one of the things that trigger you, you take a medication before that. You don't need to take it at any other time. Long term, a course of psychotherapy will help you to learn techniques that you can do ahead of time to lower your anxiety so you can make it through the process. So there's different things that you can do. A combination of medications and psychotherapy works the best, but some people prefer one or the other, and that's fine too.
Okay, all right. Okay, so let's go back to the telephone lines, and I suspect that the caller who we're going to is now listening to his or her television or radio. Good evening, caller.
Good evening.
Yes, ma'am. Go ahead, please.
Yes, I having a problem. Having a problem with.
No, we ask you to turn
the dizziness in my head.
We're going to ask you to turn down your television, please, because it's going to confuse you. You're going to hear a delay.
Okay, thank you very much. Yes.
Right.
Good night to the panel.
Good night.
A wonderful show.
Indeed,
yes,
thanks.
I was just here lying down and listening to the program. I'm having a problem with my head. I just feel dizzy every day. No care what I do. I just feel dizzy and I don't know what to do because I go to the doctor and the doctor tell me that they don't see nothing wrong with me. So I just want to, put it to the lady and see what she can tell me about it because I don't understand. Because it bothers me a lot. Even when I'm at work, I feel like I'm going to faint. I'm going to fall down. I don't know where that comes from. So if you could help me with it, please, thank you very much.
Hold the line, please, caller. Doc, you do want to relate to the caller?
I would say take my number. It's 464-9095 because I'd need more information. I'd need to know the details of what the doctor did, whether it's blood tests, a scan of your head, something else. And I'd need more history about what exactly you're feeling, what other symptoms are with it, more than we'd have time for tonight. So just call my number, 464-9095, and we can talk after the show to help figure this out.
No problem, my darling.
464-9095.
Okay, thank you very much.
You're welcome.
Okay, thanks. Doc, by the way, you've been extraordinarily gracious in, in trying to extend yourself to assist our callers. Thank you so much. We'll take probably one more caller, 462-2996, 462-2996. We'll be able to just take one more caller. Probably one Facebook quick question, Damien, if there's any particularly, if not, while waiting on the Facebook question, warning signs, Doc, of anxiety disorders. What are some of the things that we're looking at that you heard, for example, a few of the things tonight? Are those warning signs? What are the most common warning signs?
So the common warning sign you want to, let's say you're looking at your coworkers, you want to figure out, are they having an anxiety disorder? Look at whether it is causing them dysfunction in their social life or their home life. Is it causing conflicts between them and their significant other or with their children? Have you noticed a reduction in productivity at work? Are they not meeting tasks? Are they asking for extra time? Are these people taking extra time off from work? Usually it's a sign that they're struggling with something. And it may not be anxiety disorder, it could be mood disorder, it could be sleep disorder, it could be anything, but it may alert you to something going on that's not necessarily medical. You want to be open to somebody discussing their issues with you. You can ask them if something is going on. Don't push, because someone has to trust you to disclose mental health. It's confidential, it's sensitive information. But particularly a change in behavior is what you would look for. If you notice someone is struggling with some of the physical symptoms we talked about with anxiety, withdrawn behavior, sweatiness, pacing, tremors, those are signs of anxiety.
Okay, Doc, let's take our final caller for the evening. Thank you so much for joining us on House Calls. Go ahead, please. Good evening.
Hi, good evening.
Good evening to you.
I just called to say thank you, Mr. Burford. Thank you so much for this program. And also to the doctor, I just want to let her know that I'm very grateful. At least I feel a little relief. Although I don't get no good answers as yet, I just feel a little relief because I'm getting a little help from somebody. I just would like to say thank you all very, very much.
Really appreciate it. Really appreciate it. Let me pass on those thanks to our team here, led, of course, by Mrs. Brathwaite, who is the executive producer on the program. Doc, final question, final issue as we wrap up. We're pretty much in overtime already, but there's the issue of bipolar. Some people say, well, the person's bipolar. You know, they just brushed off, and you know, somebody might have a genuine problem with anxiety disorders, and someone say, well, the person is bipolar, or well, just leave them alone. They're just like that. They're just like that. You hear the term, they're just like that. But obviously, they need some sort of assistance.
Mm-hmm.
How do we ensure that we change the perception towards anxiety disorders and mental health issues generally? And people just brush it off and say, well, something's just wrong with a person.
Well, that's a whole show in itself. But mental health on a whole in Antigua needs to be redone. There is a general neglect and disrespect of mental health, not just bipolar anxiety, but mental health in general, even stemming from the government level. There are things that need to be put in place, and I think it needs to start from the government level, and then the public, by example, will then follow along in terms of having resources for mental health and being aware that they can seek help. It is okay to seek help. Because if you look at health in general in this country, internal medicine, general surgery, pediatrics, OBGYN, they're being managed in one facility. Mental health is sort of isolated in another facility that's not very well kept, hidden behind high walls, high trees. And so the perception of mental health in Antigua is stuck in about the late 1800s, where individuals need to be identified and locked away. It's 2022, and for at least 100 years, they've determined that individuals with mental health can be treated and be reintroduced into the community as functioning members. It is possible for people with mental health issues to have a job, to drive their own car, to own their own home, to have their own families. And we need to advance as a country to appreciate that mental health is treatable. It's not something that should be shunned or ridiculed. Individuals with mental health issues shouldn't be stoned or beaten or disrespected, but shown the respect that other countries, other civilized countries have shown to mental health. And so one of the things I wanted to do with some of the slides I showed is that mental health is not something taboo. It's not some sort of punishment that people have to go through because of something they've done. It's a chemical imbalance. It's occurring in the brain, which is an organ, no different from the heart, the lungs, the kidney, the liver. And so, like a medical condition, it is treatable. And so we need to, as a country, starting from the government, do proper due diligence regarding mental health. And so I hope that things will start to turn around over time. I've raised concerns with the Ministry of Health as well as the administration at the Sir Lester Bird Medical Center. I've met with the individuals who work at Clearview Psychiatric Hospital, and I just want to praise the people at Clearview because they are spinning straw into gold every day. They are working with not much resources and trying to do the best they can. Excellent. But that does not mean that we need to just accept that that is the best that we can do. We need to do better as a country and as a people.
No, we'll certainly have to get you back another time because, as you said, that's a whole show
yes,
by
it
itself.
Is.
And you're obviously very passionate about it. It's not just an avocation for Dr. Joseph, it is a vocation for her. You hear her passion coming out in this subject, and you hear how she's extended herself to the audience to assist. individuals who have actually expressed some concern. Doc, I know that there are several other questions that could have come in, but unfortunately we're out of time. We're actually in overtime. But thank you so much. We're in your debt for raising this issue and for indicating that, look, it is not a taboo subject. It is not something that somebody has, they have some sort of, we have our thing to say in the Caribbean about people who have mental health disorders. Let's stop it. Let's be clear that this is a form of healthcare as any other part of healthcare is. So if somebody says they have a joint pain, nobody casts aspersions at them. Why cast aspersions if somebody has a mental health issue or an anxiety disorder? When we come back next week, take a look at this subject that we'll be discussing.
Dr. Julia Bird is next on House Calls, March 8 at 8 p.m. on all ABS platforms. We're turning the focus on glaucoma awareness. Who is at risk? What are the warning signs? And what action do you need to take to prevent blindness from this condition?
Glaucoma is silent. The type of glaucoma we have in Antigua is called open ankle glaucoma. And there are no symptoms in the early stages.
Get your questions answered as we look closely at glaucoma on House Calls, Tuesday, March 8 at 8 p.m. The best health show in the region continues to educate and elucidate. Join us.
So, next week, do join us then for Dr. Julia Bird. In the meantime, thanks again to Dr. Chanel Joseph for her extraordinarily powerful performance this evening. You're dynamite. I mean, that was absolutely wonderful what you did this evening. Our audience appreciates it, Doc. Thanks.
You're welcome.
That's the end of our program. Really appreciate your company on behalf of the entire team, including our executive producer, Ernie Brathwaite, and our production assistant, Mary Charles, as well as the entire team. Thank you so much for watching. See you next week when Dr. Julia Bird joins us on House Calls. Good night.
Are in tune with the nation's stations, ABS TV Channel 10, the GIS, and ABS Radio 90.5 FM. Proudly serving you, reaching more and more people every day.